Raina Morgan with iHealthTube. Today we're visiting with Dr. Gloria Gilbere. She wrote the book, I Was Poisoned by My Body. And she also has fibromyalgia as one of the effects of that. And I also have fibromyalgia. And we're going to talk about reducing the toxic load today, Doctor.
Yes, and you and I have discussed on many programs before the fact that most people are not validated when they have fibromyalgia.
That's true.
Isn't
That's
it? I mean, and
true.
sometimes it's so demeaning and so insulting for a doctor to offer you an antidepressant. We don't have a Prozac deficiency.
I know.
And they look at us like we're just some hysterical, especially if you're a woman, that whose hormones are off and maybe a little antidepressant will take care of the problem, right?
Just aging.
Exactly, just aging, and
Menopause.
especially when we're baby boomers. So what ends up happening is, since we already know scientifically that 75 to 80% of our immune system is based in our gut, we must start with reducing the toxic load in the intestinal tract.
Okay.
Remember, we talked in a previous program about the effects of that toxic load then being recirculated into the liver.
Right.
So we need to reduce that toxic load, and it's much like having a glass,
Okay.
and that particular glass is your body. So all of the inflammatory foods, all of the preservatives, all of the synthetic substances that we're exposed to or we absorb through the skin add to that toxic load.
Okay.
And in order for us to be able to repair the body, rather than let the cup overflow, which is what gives us fibromyalgia and the autoimmune disorders, we have to poke a hole in that cup to reduce that toxic load. That's probably the best analogy I can give you.
And how do we do that?
Well, the best way that I have found is by using a fiber supplement that is comprehensive, that'll take care of acting as a rotor-rooter brush is what I call it. So you have to have a rotor-rooter inside of the intestines in order to brush the debris, much like putting a snake or some type of a cleanser down your drain.
Okay.
Okay? Because most people, especially in westernized diets, modern diets, we don't need enough fiber.
No, we don't.
And I know when I'm teaching, many people will say, well, I don't want to take any more supplements. Can't I just do it with my diet?
Right.
And so I always have two very large, we should have done that today, two very large turkey-sized platters of raw vegetables, as high as turkey size, yes, as high as you can pile them.
Okay.
And if you can consume 2 of those raw a day,
Raw.
you don't need to take 4 or 5
Fiber tablets.
fiber tablets. So I mean, it's as simple as that, so that we can actually rotor-rooter those intestines, get the debris and the sludge, which we call colonic plaque,
Okay.
out of there. And the analogy can also be made that the reason we go to a hygienist, and as you know, I was in dentistry,
That's right.
the reason that we go to a hygienist is because they get the plaque that we can't get off with a toothbrush. It's the same with the intestines.
Ah, that's a good analogy.
Isn't that a good analogy?
Yes.
And a patient gave me that. It wasn't my idea.
Okay.
But it's being able to get that plaque out versus just the everyday elimination that our body has. And as westernized people, we just have this thing about talking about elimination. Yet
That's right.
And you talk to the Europeans and you talk to the Asians. I work a lot with doctors in Singapore and in Malaysia, medical doctors. And they talk freely about it. I talk about it on my radio show all the time, but Americans are just now getting to where they want to talk about their colon. It's like taboo. And yet that's where our immune system is based. So that's how you start to reduce the toxic load.
That's where you begin.
That's where you begin. Those are the rotor-rooter brushes.
Okay, well, thank you for joining us, Doctor.
You're very welcome.